Hi, everyone. I'm Yasmin, and I'm a patient partner on the Midwest Toronto OHT, and I'm also the patient vice chair. And so I chair our patient and caregiver advisory council. And I'm so grateful to share a bit of my personal story today and highlight the value of patient-reported indicators in shaping better healthcare experiences. And I wanted to start off by saying that these indicators are so much more than just numbers. They represent our voices and our lived experience. And to give an example of the story behind an indicator, I wanted to talk about two of the indicators that Walter just highlighted that really resonated with me around involvement in decision-making. So the ones around how patients are involved as much as they want to be in care decisions, and patients discussed what is most important to managing health and well-being with their provider. And to me, these indicators really strike at the core of patient-centered care and empowerment. And the reason why these indicators spoke to me is because of my experience as a patient. And for background, it took me a long time to feel fully involved in decisions with my family doctor and feeling heard by my physicians and participating actively in care made a big difference in my treatment plan and healthcare experience. And I wanted to give an example of how my involvement in decisions around my own care changed my treatments for the better, thankfully. So just to give a little bit more background, I've had high blood pressure for the past few years because of my kidneys, and I also have ADHD. So the treatment for ADHD is stimulants, which can raise your blood pressure. And because of this tricky situation, my specialist took me off stimulants completely and put me on blood pressure medication, which is an approach that is in line with best practices, but didn't exactly consider the impact this would have in my daily life. So this had a devastating impact on my work and school. So I'm doing a PhD, as Walter stated in my intro, and that involves a lot of writing, and writing that I just couldn't get done for the 8 months I was off my ADHD medication. And I also had bad side effects from the blood pressure medication too that they put me on, like just brain fog, feeling tired all the time. So my family doctor eventually sat me down and asked me how I was doing school-wise off stimulants, to which I told him that I wasn't doing well at all. And I remember that day because he looked me in the eyes and he said, "Let's find a solution that works for you." And long story short, after a lot of trial and error for a few months, we were dedicated to finding a solution that worked for both ADHD and blood pressure. And I ended up on a low dose of ADHD medication and a new blood pressure medication that works really well for me. And I just have to take my blood pressure, measure it every day to make sure it's working, and it is. So this is a happier story, and I'm sharing the story to show how my family doctor involved me in decision making, and we worked together towards managing my health and well-being. And I see this as so important because patients shouldn't just be passengers in our healthcare journey. We should be co-pilots, and primary care providers can make that a reality. And if I were to complete those survey questions today, my responses would be positive, but this isn't always the case for patients. And in most of my healthcare journey, I have not been involved in decisions around my own care. So happier outcome, but a really tough journey that I've been through. So documenting patient experiences is crucial. It helps us see the bigger picture and also areas where we can improve too. And most importantly, it's a way of amplifying our voice and moving us towards a health system that is truly centered. So I'm bringing this up, but I also wanted to talk about this event that we had to talk to patients and families in November. So HSPN held an in-person Café Scientifique in Toronto, and this event was about putting patients' experience data into action, where we had group discussions around ways to capture and share survey data. And I wanted to highlight just 3 key themes that really came out of this rich discussion at the event. So the first theme is on surveys as a valuable feedback tool in primary care. And attendees at the event, they spoke about the valuable insights that surveys can provide on patient experience and how they're essential for capturing patient perspectives and also identifying gaps in care. And attendees also highlighted the need for short, accessible, and co-designed surveys with patient-centered feedback mechanisms. And to really make the most out of the value surveys can have, attendees stressed thinking through issues like anonymity, equity, and inclusivity to ensure that we have diverse populations represented. Then the next theme was around the need for systemic and organizational accountability. And attendees here, they highlighted how surveys should actually influence primary care practices and policy decisions. So we should be seeing these changes in practice, and how there should be incentives and accountability mechanisms in place for providers, in addition to co-designed solutions that can drive service improvement. And then the last theme was on promoting transparency and data sharing. So attendees really emphasized how survey results and practice changes should be communicated to patients in an easy to read and clear format, such as through infographics or on a website, to promote transparency. And they felt that patients should be updated on how their feedback leads to care improvements, and that patients need to see how their feedback is influencing change to encourage continued participation. And this, of course, also applies to providers as well. So keeping both patients and providers in the loop. And we can't just do this with patients or just with providers. We need all perspectives to really optimize change. So this is just a very high-level summary of some key themes that stood up from our engagement in November, but we're also going to have another one of these events in March with patients, so you can sign up for it. I think, Walter, will you go over where to sign up for it?